The reason why I've really loved this residency and grown to love it even more is because of the culture.
I knew that this program offered opportunities for ER, for inpatient, for outpatient, for OB, kind of the whole broad range of things.
None of the other programs have the amount of training that you get here in the widest scopes that you can be able to practice in middle of nowhere.
We live in a beautiful agricultural environment. We're getting to work with a lot of farmers, having a lot of friends who work within the agricultural community. So the culture is very much small town vibes. Everyone knows you.
I have gotten asked, why do I stay in Caldwell? The people.
The people really help make the Caldwell residency program. You have the opportunity to rotate with specialists, attendings, faculty, co-residents that are all affable individuals.
Everyone is excited to help teach you, excited for you to learn, and it's a very comforting and welcoming environment.
Caldwell essentially allows you to say if you want to do more scopes, you want to do more outpatient procedures, or if you want to do more derm.
I have the privilege of working with the family medicine residents on the endoscopy and GI service. The residents do all types of endoscopies.
We frequently will produce residents who are absolutely competent to perform upper and lower endoscopies and are capable of getting credentials for whatever communities they go to.
So not only do we rotate at our home base here at Caldwell, the 150-bed hospital with a bustling OR and a very busy emergency room, we also rotate at St. Luke's Hospital in Boise, which is 579 beds. They're in the middle of an expansion, bringing it close to 700 beds. It also is the only pediatric hospital in the state. We also rotate at St. Alphonsus Medical Center, which is the state's largest trauma center and only neurotrauma ICU in the state. In addition to that, we have rotations set up at the VA Medical Center and St. Luke's in Nampa. That gives you a wide range of training at large trauma centers as well as our home base here at West Valley in Caldwell.
They're able to see a huge variety of sometimes somewhat unusual conditions that come through that we're able to take care of here locally in the Valley.
Multiple of our graduates have gone on to our fellowships and then have stayed right here in our community.
My goal is to try to get them comfortable with some of the more common cardiac problems, both diagnostics and management, arrhythmias, acute heart failure, all essential skills that they're going to need to have, especially if they're at a community hospital.
Our program is part of the WWAMI Family Medicine Residency Network out of the University of Washington in Seattle, which is a huge bonus. It provides a lot of resources for the residents.
People treat you as a colleague. You still get the respect of the nurses and the hospital community in general, and you're really integrated in by all the specialists. They all just really like to teach.
I ranked Caldwell because they offered full spectrum family medicine, and to me that means there's nothing you will not have the opportunity to do.
I was able to have the freedom to practice OMT and musculoskeletal medicine, and then also do OB and women's health and kind of pursue my interests that I am willing to practice after residency.
One of the great things about this program is that it's associated with the sports medicine program, and that there are actually a lot of opportunities here in the Valley for sports medicine. And if you are interested in sports med particularly, you can do an audition rotation here at Boise State. They have the Idaho Sports Medicine Institute, which is fantastic.
If you want to be a well-rounded family medicine physician, prepared to perform in hospitalist medicine, outpatient clinic, laborist, emergency medicine, endoscopy, and inpatient procedures, this is the program for you.